my name is Taylor Ho, and today I'm going to be talking about the flu virus, specifically the H1N1 strain. So first I'm going to begin by talking about the taxonomy and the characteristics. So the formal name is influenza A H1N1 PDM09. The more common name that most people know this by is the swine flu. It is part of the kingdom Orthonavirae, the phylum Nagarnaviricata, the class Insilviricites, the order Articulovirales, the family Orthomyxoviridae, the genus Alpha influenza virus, the species Influenza A virus, and the serotype Influenza A virus subtype H1N1. So some of the characteristics of this virus are: it is part of the family of the orthomyxoviruses. It is spherical in shape. It sometimes can also be found in an irregular shape. Its size ranges from 80 to 120 nanometers. It is a single-stranded enveloped RNA genome. So some of the characteristics also of the virus are these blue projections coming off the virus are the hemagglutinins. These are the proteins that the virus uses to attach to the host cells. And then these purple pinkish projections are the neuraminidase. These enable the virus to release from the host cell. So inside of the virus there is the M2 ion channel, which allows protons to move through the viral envelope, and this is essential for the viral replication. And also essential for viral replication is the ribonucleoprotein, which is also found in this virus. It contains the virus RNA genome. So what distinguishes this strain of Influenza A from the other strains is the surface proteins. These would be the hemagglutinin and the neuraminidase. And the other strains of the Influenza A virus are the H1N2 and the H3N2. So modes of transmission for this virus are direct contact with this would be direct contact with like respiratory droplets or saliva, and then touching your eyes, mouth, or nose with like unclean hands. It could also be transmitted through airborne particles, so like inhalation of oral contact through mucous surfaces with respiratory droplets. So close contact is about like 3 feet or less, which is usually what is needed for this type of spread. This can also be spread through zoonosis and then the reservoir would be pigs. This is very rare. There's only been 12 cases since 2005, but this is usually seen in people who have close association with pigs, since the swine flu did originate from pigs. So this would be most often seen in people who have close contact with pigs, such as veterinarians, farmers, or pig herders, and these are primarily transmitted through respiratory droplets of infected animals with like someone who's not wearing a mask or not wearing gloves and handling these animals. So how these viruses infect the body are through the upper respiratory tract, and they cause inflammation of the upper respiratory passages, the trachea, and sometimes even the lower respiratory tract. The cells that they are targeting are the columnar epithelial cells of the respiratory tract. So virulence mechanisms. So the influenza virus, the hemagglutinin binds to the sialic acid containing receptors. The oligomerized M2 protein forms an ion channel, which is necessary for viral encoding. They target the nucleus of the infected cells, and inside these infected cells, the viral genome serves as a template for synthesis of mRNA and cRNA. And then the neuraminidase protein cleaves sialic acid and facilitates the release of emerging virions. And then the NS1 function in evading host immune responses, and then the NAP mediates the export of the viral RNPs from the nucleus, which then infects the viruses just spread throughout the whole body. So next I'm going to talk about the incidence and prevalence. So the first incidence of the H1N1 strain in the U.S. was in 1976 in the outbreak in Fort Dix, New Jersey. This was the first confirmed case was of a military personnel. That is the one death that is shown on this in my slides. And then this is this infected less than 200 people, so a lot of research wasn't put into it. But then in 2009, the swine flu pandemic occurred, and this map shows the beginning of the swine flu pandemic, which shows like it's originated in like the U.S. and then it's spread through the Americas through like Canada and Mexico, and then it eventually spread across the world, making it a pandemic. And in this pandemic, there was over 59 million cases and more than 18,000 deaths occurred due to the H1N1 virus. And now in 2020, it's not as common anymore because there is a vaccine now. So the immune response, these are the innate and adaptive immune responses. So the H1N1 virus altered the innate and adaptive immune responses through an increase in the regular T cells and a reduction in dendritic cells and T cells. So some immunity that has been built up throughout like repeated exposure to like seasonal influenza viruses and getting your flu shot and vaccinations these have resulted in like partial cell mediated or humoral immunity to influenza virus H1N1. This is partially done by interfering with antiviral and pro-inflammatory cytokine gene expression in the human macrophages and dendritic cells. So the population that is most at risk for the H1N1 virus is children younger than 5, but especially children younger than 2 years old, adults 65 years of age and older, pregnant women, people with pre-existing conditions like asthma, chronic lung disease, heart disease, diabetes, and then also people with compromised immune systems due to diseases or medications. So for compromised immune systems, those would be like HIV, people that have HIV or AIDS or cancer, and then those that are compromised due to medications would be like, this is specific, but people 19 years of age who are receiving long-term aspirin therapy, or people younger than 19 years of age that are receiving aspirin therapy. So some symptoms, they're the typical, these are typical like flu-like symptoms: the fever, cough, sore throat, runny or stuffy nose, body aches, headaches, chills, fatigue, and the ones that are not common to the regular seasonal flu would be diarrhea and vomiting, which is something that came about through the H1N1 virus. It started showing up more as a symptom. So that is something that distinguishes the H1N1 virus for the regular seasonal flu. Some complications of the H1N1 viruses are the worsening of chronic conditions, such as like heart disease and asthma, and then there are life-threatening complications such as pneumonia and respiratory failure in many people, and then other complications are neurological signs and symptoms. These are like anything from confusion to seizures. So the incubation period is typically between 2 to 3 days, but it can occur between 1 and 7 days in some people. So the contagious period is 1 day before the illness onset, and then 5 to 7 days after symptoms start developing. Something that is different about the H1N1 virus is the contagious period may be longer for individuals with the compromised immune systems and for children. The typical like incubation period, the contagious period would be between like 10 and 14 days. So the diagnosis of this virus would be done through going to the doctor and the doctor will conduct a physical exam based on signs and symptoms that the patient is exhibiting, and then usually there would be a rapid influenza diagnostic test. This is like the cotton swab that they stick up your nose or down your throat, and this is just testing for antigens to see if you have the flu or not. And then there are more specific flu tests to look to see what specific strain you have, but these are only available in like specialized hospitals and labs. And then the treatment for this flu is specific. Like a lot of it is like symptom specific treatment, but the antivirals that are listed right here are usually things that are prescribed for someone that would have the H1N1 virus that is not as severe. So oseltamivir, which is Tamiflu, zanamivir, which is Relenza, peramivir, which is Rapivab, and baloxavir, which is Xofluza. There is an H1N1 swine flu vaccine, which is available through a shot, but it is an inactivated vaccine that is usually given with the needle, usually in the arm, which is the shot. And then it is now the same as the seasonal flu in the way that is being made. You can get the H1N1 vaccine and the flu shot in the same shot. And the vaccine also comes in a nasal spray. This vaccine is made with live weakened viruses that do not cause the flu. Sometimes you will hear it referred to as the LAIV, which is the live attenuated influenza vaccine. It is approved for people 2 years to 49 years old who are not pregnant. And how the vaccine works is 2 weeks post-vaccination, antibodies will start to provide protection against the H1N1 influenza virus, and they will all start to develop in your body. So a couple ways to prevent yourself from getting sick with the virus is to wash your hands with soap and water. If that's not available, then use hand sanitizer. Avoid close contact with people who are sick. Stay home when you're sick. Avoid touching your eyes, nose, or mouth with unwashed hands. Practice good health habits like cleaning, disinfecting, frequently touch surfaces, plenty of sleep, physically active, manage your stress, plenty of fluids, and then also getting your flu shot. So some research efforts in the future outlook based on the research that has been done is they have now are able to see the gene sequences of all the influenza particles in a single specimen. This is due to their ability to map the complete influenza virus genome. And it still has to improve exponentially, but they are optimistic. And then exploring new ways of development for more effective influenza vaccines, increasing the capacity of the CDC laboratories to select, develop, and evaluate and perform virus characterizations. And then the CDC is also piloting advanced strategies to identify viruses. And these are my references, and thank you all for listening, and I look forward to all your questions.